Are you facing issues like leakage of urine while coughing or laughing or while doing some weightlifting exercises in the gym? That means you have stress urinary incontinence. And let us discuss about this today. Hi everyone, I am Dr. 𝐲𝐬𝐬𝐿 Appasani, cosmetic and functional gynecologist from Eternelle Aesthetics, Hyderabad. So what is this urinary incontinence? Urinary incontinence is nothing but there is leakage of urine when there is increase in the pressure on the bladder. That means maybe because of laughing or coughing or just doing weightlifting exercises or sometimes just sitting on the floor and getting up. So when there is increase in pressure on the bladder or on the abdomen, there might be little bit dribbling of urine, or some patients might have more urine leakage. This is ideally called stress urinary incontinence. Some patients also might have urge incontinence, which is nothing but sometimes when they have urinary leakage before they go to the washroom. That means the moment they think about washroom, they might leak some urine or dribble some urine. This is called urge incontinence, and most commonly what we see is a mixture of both, that is mixed urinary incontinence. And most commonly what we see are stress urinary incontinence, which generally women face post deliveries. So post a vaginal delivery, that's a normal birth, they might have some trauma to the pelvic floor muscle, which might lead to stress urinary incontinence. This is more in some individuals and this might be less in some individual, depending on what exercises or what is their body type. Some women do pelvic floor strengthening exercises from a very early age. That means from their 20s onwards itself, they do pelvic floor strengthening, that is 𝐸𝐞𝐿 exercises. And later on, slowly they deliver, and also they do post-delivery exercises. In these people, maybe the symptoms are less or nil. In some patients who have actually their body is deficient in collagen, or they have little loose type of a body, they might face more of this urine leakage after their deliveries or just as such with time. And some patient might also have it because of their weight issues, that is if they have an excess weight gain during pregnancy or sudden history of weight gain or weight loss or anything because of their obesity nature. These patients also might have less muscle mass in their pelvic floor, causing them for stress urinary incontinence. So in some women post their vaginal delivery, they might be facing this stress urinary incontinence, but as they strengthen their pelvic floor and as they continue their exercises, it might recover by 2 years postpartum, that is post delivery. Within 2 years they might recover from these symptoms. But some patients might still continue having their symptoms and it will just worsen with time if they don't take any action. And post menopause, that is when their hormones are completely subsided, these symptoms will increase further. And it's very simple to treat this stress urinary incontinence. It's just by strengthening our pelvic floor muscle. And let me show you how to get it treated, that too non-surgically. So this chair is called an Emsella chair. And this chair helps in strengthening the pelvic floor muscles by stimulating electromagnetic waves which trigger the pelvic floor muscles and strengthen them. And this chair we can do 10,000 𝐸𝐞𝐿 exercises, that is pelvic floor strengthening exercises, in just 30 minutes. But then these are session based treatment what we do, and the number of sessions depends on what is the age of the patient, what is the pelvic floor muscle strength. Depending on all these factors, we decide the number of sessions. And by strengthening the pelvic floor muscle, the urine pipe which comes through the pelvic floor can be nicely occluded at the time of pressure, like while coughing or while sneezing or while doing heavy weight exercises in the gym. We can tighten the pelvic floor so that there is no urine leakage. And ideally it should be done by all women post their deliveries, so that at the time of delivery the deficit what they have in their pelvic floor because of their natural vaginal birth is covered by these sessions, by strengthening the pelvic floor, so that they won't face such urine leakage issues also in future. So if you find this video informative, you can like, share and subscribe to our YouTube channel. And if you have any further doubts on stress urinary incontinence, you can comment below so that we can revert back to you.